Welcome back to Startup Health Now, where we celebrate the entrepreneurs and innovators who are transforming health. In this week's episode, we're excited to welcome Lee Shapiro, managing partner of Seven Wire Ventures and seasoned investor in the digital health sector. Lee shares his passion for enabling entrepreneurs to transform healthcare, drawing on his extensive experience with successful companies like Livongo. Join us as we explore the challenges and opportunities currently facing healthcare funding in mid-2025. Lee and Startup Health's CEO, Stephen Krein, dive into critical topics such as the stagnation of the IPO market, the necessity for sustainable business models, and the significance of showing clear ROI in healthcare offerings. Our discussion also sheds light on innovative solutions to enhance patient experiences while navigating the complexities of fundraising and regulatory challenges, especially in today's economic climate. Listen in as Stephen Krein chats with Lee Shapiro in this Fireside Chat, held in front of an interactive audience of health transformers in the startup health community.
What a perfect reminder about why we're all doing what we're doing in this moment. And I think a good breath of fresh air around the idea of the collaboration that is possible when you bring founders together and funders together and partners together to collaborate. And I am incredibly excited about today's call. I'm Stephen Krein, for those who I haven't met, but I am thrilled to be here again today to welcome back a longtime friend and supporter and investor in startup health, Lee Shapiro, who is the managing director. And I feel like he's gotten so many of these introductions over the years from us, but the managing partner of Seven Wire Ventures, a firm he co-founded with his great partner and one of our other friends, Glenn Tolman, more than a decade ago. Seven Wire is one of the most respected early stage VC firms in digital health and healthcare. I think they're backing companies like Livongo and Transcarent and so many others. Lee was the CFO of Livongo, where he helped lead its IPO back in 2019. It was one of the biggest exits in the space. And before that, he served as the president of Allscripts. He serves on so many boards, but one of the things that I think makes Lee so special is he's chairing almost, I think 3 months from now, the American Heart Association's board, which he has been a member of for many years. And I've had the privilege of doing so many of these with Lee over the years, sometimes alone, sometimes with his partner Glenn. And he's always sharp and generous with his insights, and he's always so focused on what matters most to founders. So as always, this is an interactive session. I'm going to hand it over to Lee for a couple of words, but this is meant to be an opportunity for you to interact and ask questions to Lee. Love you to post the questions in the chat. Our team will organize them and we'll bring them up to Lee. So Lee, you don't have to worry about managing the chat. But as the only question I ask everyone to do is when you only request is if you have a question, introduce yourself before asking the question. So Lee Shapiro, good to see you, my friend.
Well, with an introduction like that, all I have to say is it was great to see all of you. Thanks for showing up. Appreciate you being here. But no, Steve and Unity, Lauren, Jen, thank you so much for letting me have the privilege of speaking with founders. You know what we do, we couldn't do without each and every one of you pursuing your dreams, for sharing your visions with us and allowing us to just be along for the ride as you pursue your journeys in bringing better healthcare to those of us around the world who are in desperate need of these solutions. And, you know, part of what gets us excited every single day is the opportunity that we have to be able to work with founders. We invest early stage, as Steve mentioned. We're seed and Series A investors. We have a particular focus in an area of tech-enabled services that move care outside the four walls of hospitals and outside of doctors' offices. But even for those companies that don't necessarily fall within our thesis, we try to be helpful. We try to do things that can help build connections. That's so much of what we like to do in being able to help support founders in building those businesses. Because if you're successful, a rising tide, frankly, lifts all ships. We want the sector to be doing important work. And the moonshots that each of you are participating in are so important, so worthy. And every time I see the video, I get excited. My heart starts to beat a lot faster, and I've seen it a lot of times. And every time it doesn't age. It continues to inspire, and each and every one of you continue to inspire me. So thank you for letting me chat with you today.
Well, Lee, thank you for being here. And I was talking to Unity earlier, and I was saying I had looked back on our previous fireside chats, both ours, the ones that you did with Glenn, the ones that many of your colleagues at Seven Wire have done, and there's so much timeless wisdom that is applicable today as ever. And so I know that we can cut up and have video snippets and snackable bites of all the wonderful things you said, but I thought we might start off with a little bit of the lay of the land of where we are in, coming into the middle of the second quarter of 2025. It's been a long 2025. But I'd love to kind of get your take, if you would, on a little bit of what maybe has changed in some of the predictions that you made going into 2025, and maybe what hasn't at all. Again, some context would be wonderful.
So, Steve, Unity, Lauren, Jen, and I were chatting a little bit before we started our session today. And I said, I feel like I've aged a lot in the last 100 days. Coming into the year, and please, don't take any of this as a political statement. I'm trying to be objective with regard to this. The economy was, humming. Unemployment was low. As we were kind of moving our way towards the end of the year, I think there was a lot of anticipation from the stock market rally that occurred after the election that we'd see less regulation, we'd see an opening of markets, and in particular, with interest rates poised to come down, that there'd be a reopening of the IPO market. We're early stage investors, so we're not waiting for our companies to have IPO exits. But what I hope you all appreciate is the importance of having a robust IPO market for the technology sector in general, and for our sector in healthcare specifically, is that frees up capital. It frees up investable capital so that as those exits occur, that's a return of funds to limited partners and late stage funds that then invest in early stage funds. And while we've been fortunate to raise the type of capital that we've wanted to have to support the businesses that we work with, it's a challenging environment for raising capital right now. The IPO market, again, as I thought would be opening this year after being closed for a good part of the last 2 years, is one that will likely remain closed this year as well. And that's a macro factor that's impacting us. Another factor is uncertainty in the market. For those of you who are selling into health systems in particular, that many of them have been impacted by loss of research funding. They're very concerned about what's going to occur with the cost of their supplies, because we get, for example, a lot of our personal protective equipment is sourced from overseas that would be subject to tariffs. And so what you're hearing from many of our LPs, we have over a dozen health systems who are partners in our funds. They're uncertain, and when people are uncertain, they wait. They don't make decisions. They're not making investments in a variety of things that one would hope they might make investments in. They also have deep concerns about what might happen later this year when subsidies for those who receive insurance through the exchanges fall away. That could lead to 4 million or so more people without insurance. That doesn't mean they're not going to show up at their hospitals. They're still going to show up. It's just that the ability to pay is going to be reduced. And so how do you continue to provide care in that environment? So again, it creates uncertainty. Yesterday, or it was the day before, there's a healthcare conference where I'm at in Chicago, where a number of CEOs were there. And I met with a safety net hospital CEO that operates on very low margins. They're at 1%. By the way, if your long-term margins are at 1%, not likely you're going to get a lot of venture capital. But this is a hospital, and our hospitals operate, as you know, on average at about 3% margins. But he's a safety net hospital at 1% margins, and he said that they lost $40 million in research funding. Now, not all of that was profit, but what we don't fully understand is that a lot of those dollars go to paying the salaries of people who are not only doing research, but they're also providing care. That's really hard for him to make up. And then he lost a government subsidized program to be providing vaccines into the Medicaid and Children's Health Insurance Program, CHIPS program. And so that's another 26 million. So he said, I'm in the hole already for this year, and we're 100, and some odd days in, and I'm already in the hole, for this year, and I've got to figure out how I'm going to sustain my profits. So I think that, those are some of the macro issues as well. We're waiting to see what occurs with regard to health policy. While we saw an increase in rates being paid to Medicare Advantage, on the other side of the coin, there have been proposals from a budgetary standpoint that will reduce $88 billion out of Medicare and Medicaid over the course of the next 10 years. What's that going to mean to programs for those of us who have companies, your companies that might sell into those marketplaces? So I would say uncertainty. The one thing that I will say that's a positive about this, because I actually see a few of you on the screen crying, so I didn't mean to upset you. But the bright side is that what many of you are doing in significant ways are improving access to care and reducing the cost of care. There is, you can't necessarily fault the administration from coming in and saying there's waste in healthcare. We know there's waste in healthcare. Fraud and abuse is one area, maybe not the most significant area, but there's a lot of waste, and estimates have been, irrespective of administration, that of the trillions we spend in healthcare, there are hundreds of billions of waste. So there are opportunities to be thinking about ways that we can be delivering better care and delivering at lower costs, and there will be demand for those solutions in the market. And so that's good reason to stick with what you're doing.
Yeah, I think for a good segue to kind of really what you're advising your portfolio companies to do and how to operate differently under these times of uncertainty. I think there's probably a lot of prospective companies you might have been in the process of funding or were in the beginning stages of funding. What are you talking to them about? How are you navigating what you just described to what that means to their day-to-day at maybe all three levels, the ones that were kind of just beginning, the ones you were kind of deep, ready to go? Because one of the questions that came up in the chat was in the middle of fundraising, some of the practical things that founders have to deal with.
So, our song sheet hasn't changed a whole lot since the pandemic, really. And, we've been telling companies that you need to focus on building profitable business models. As early stage companies, it requires investment. We know it requires investment. But you can't show up with a business plan if you're looking for funding that says that you'll be profitable 5 years from now. Those days are gone, unless you're in AI, in which case I'd say good luck to you, because that bubble will burst. But for right now, there are a lot of dollars chasing rainbows there. But suffice it to say, there's a significant need to be able to demonstrate that how you're building your business model is something that's able to achieve some scaling effect and do it profitably. I've said before, and I apologize for those who have heard me previously, but we focus in the areas that we work on three things that are important. The first one may not necessarily apply to all of you, but the last two will. Because we focus on delivery of care outside the four walls of healthcare institutions, we want to make sure that there's a great patient experience, a great consumer experience that exists, because that's the magnet that attracts people and keeps them coming back to utilize an offering. But that offering won't be valuable unless it can do the second step, which I think is universal across all of us, which is you have to be able to demonstrate objectively that you can improve outcomes. And lastly, you have to be able to do that at a return on investment to your customer that's going to move the needle. We look for at least 2 times, if not 3x ROI to the buyer. So if you're costing him $1, you got to save him 3. And those things are important. If you demonstrate those things, that will also be important to those who are investing in you, because you can show that you're able to build something that's going to be attractive to the customers. And if you're able to, in addition to that, show where you have some customers who are actually utilizing the offering and have the data to back up your proposition, that would be important as well.
So, first of all, incredibly helpful on precise metrics, ROI. I think sharpening that pencil has become even more of a practice. I think I was looking back at some of the videos. We even did one during the pandemic, actually, to reflect back on some of the things that you're saying, which are completely aligned with that. But I'm wondering, we're living in a world where the information or misinformation about what's going on in healthcare overall is hard to keep up with. How much of the noise that's going on in the environment is affecting the companies that you're working with in terms of customer penetration, fundraising success, and just kind of navigating how to deal with the flood of misinformation when it comes to customers and funders?
So I'll give an example of a company from the portfolio that's been kind of squarely in the sights of some of the noise that you mentioned. That's a company called Folks Health. They're in the LGBTQIA plus space. They deliver culturally sensitive care to the community that they serve. And they've been involved in providing anything from gender affirming therapy through to primary care and behavioral health services. The benefit for that company is they don't take Medicare or Medicaid payments. So government funded programs, the cutbacks and some of the rule changes that have occurred there hasn't affected their business because they weren't relying on it. They also, I think of it as the 4 M's: Medicare, Medicaid, military. They're not working in military programs, and they don't serve minors. So the areas that the government has been most focused on in terms of rule changes, they're not impacted by. What I will say is that there's a tremendous amount of anxiety in that community. And because of that, the best 3 months we've ever had in the history of the company have been the first 3 months of this year. So the policy headwinds have turned into a tailwind because there's a recognition that we can provide services, that we're going to be able to do it in a way that's confidential and protected, and that we're going to be able to operate even in states where there are restrictive laws because of the way in which our services are delivered. Now, there are other companies that have some concerns about impacts of programs. So we have companies that sell into managed Medicaid. The Medicaid plans that we work with, including many of the states, are quite concerned about the funding cuts that they're going to be receiving. Again, the benefit is that we can deliver care at a return on investment to those plans. And so in some cases, we're getting more dollars shifted our way so we can help more people with the fewer dollars that may be available in order to deliver care. So, there's uncertainty, I'd say slowing in sales cycles that's occurring. And the one thing that I would share with you, for those of you who are fundraising, is to be very upfront and open about how you're assessing the impact that's occurring, including saying, we don't know. This is what we believe to be the case, but even the policymakers haven't staked out ground yet. We don't know for sure, but we do know that if we stick to the fundamentals of the things that we're doing to be able to provide great services with objectively proven outcomes, I think at the end of the day that science will continue to provide us with the right compass for how we direct our efforts. And I'm not one that can believe in alternative facts. I think there's a set of things that are true and that you can use as guidance for your business. And if you follow that course, I think that you'll still remain amongst the companies that will succeed, as opposed to those that are running into issues. Last quick comment just to make, because Steve, I know you're trying to say something, but it occurs to me, I was with earlier today at a board meeting, CEO of one of the largest global pharmaceutical companies in the world, who one of their largest businesses is in the vaccines space. And there's a lot of concern about vaccines, as going forward. And yet, they say that they're continuing to provide vaccines, not only here in the US. There's a recognition that you need to be able to stop um, epidemics, like we're seeing with measles in West Texas, and that they're continuing to supply vaccines around the world. And so they're not cutting back production, in light of that. And I think that's an important message for all of us.
Yeah, I
Apologies.
think, yeah, I mean, I think, and I know you don't do therapeutics and some of the other areas that we have companies from our type 1 diabetes moonshot community and our Alzheimer's community, moonshot community on the call as well. But I wanted to give a couple of the founders on the call a chance to ask some questions, some very practical about strategies that might be relevant, even though it might not be your area of investing. But I think there's a lot of bridging between grants, early stage foundations and family offices and venture. And so maybe demystifying a little bit of the venture kind of on ramp, because I think you mentioned a number of times in obviously several other episodes that we've done about the importance of building relationships with VC. So I'm going to introduce or give Ed Raskin a chance to introduce himself and ask the first question. And we'll swing back around to some of the macro stuff, but this is a very specific thing affected by the macro environment. Go ahead, Ed.
Yeah, very much so. Thanks, Steve, for the intro and Lee for your time. We're in the therapeutic space in type 1. I won't bore you with the details, but interested in your perspective on being in the enviable position of having a term sheet on a seed where you sort of have, a lead investor identified, and then the alchemy around filling out the round. A lead investor may come in and say, hey, we've got 25, 30% or so. We'll work with you and our network to maybe help you top this up. But of course, the responsibility is, on the company side to get this done. Wondering if you can provide your thoughts on making that alchemy work. How do you think about it from an investor perspective? Just seeing that term sheet give you some FOMO if you said no in the past. What would you do if you were in our shoes in terms of trying to get to new eyeballs on this and with the eye to topping it up?
Yeah, happy to help. So a few things. You're absolutely right. You can't rely on the lead term sheet to advance the ball with regard to getting the syndicate filled out. They may be very helpful, but at the end of the day, the responsibility is yours. So first thing is, I suspect that during the course of fundraising, you met with a number of people who said, love the idea of what you're doing, but we don't lead, or come back to us when you have a lead. That is fairly standard in most fundraising processes. And so those organizations would probably be top of the list. There may be some who said, we'd only lead, and if you select another term sheet, we won't join in. That may be bluffing in some respects. And so, even if someone had said, we only lead and we won't participate if we don't, you can go back to them as well. Strategics are really important. So, as you think in the space that you're in, there may very well be, for example, some life sciences, Lilly Ventures, I'll just mention, Novo Ventures. They're very engaged in the diabetes space, as they could be strategic. They may want to have a sense of what it is you're doing and write a check into that. A number of charitable organizations have the ability to fund in. So there's T1D. I'm going to get the
Yeah,
name
I
wrong.
think is one of them is already in advance. Is it? I don't know if it's public yet, Ed, so I don't know what to say it.
Yeah, not quite yet. Yep. So I guess
But
maybe to narrow a little bit, if you don't mind,
yeah,
Lee, assume the usual suspects. You have a slew of either no's or you've kind of tapped out your network. What do you think is an effective strategy of sort of getting in front of new eyeballs, or perhaps the holy land that seems unfindable of the family office network? Those new places to go once you have that term sheet in hand. Maybe if that helps.
it is a lot of cold calling, to be honest, and it's asking for introductions. I would say that in reaching out and looking for other opportunities to invest, to find investors, there are resources like PitchBook, for example, that you can go to where you can see who's been active in the areas that you're interested in, what else have they invested in, and you can just start to call some of those investors and I will tell you that we do it, maybe others do it as well, is that there's a company that I've spoken to earlier this week, said it's not in thesis for us. I made an introduction to one group that I thought might be interested from an investing standpoint, and also to a key opinion leader in the space that I said could know some individuals that might be interested in investing. So you do have to beat the bushes in that regard. And unfortunately, it's part of the lonely work, that you do as a founder in making that happen. With respect to family offices, I'd be hesitant about showing up at the various family office forums. There's a number of these meetings that are held for a group of family offices. I haven't found any of our companies that have been successful in showing up, and you pay an entry fee, and and the conference organizers relying on all these companies that are hungry to raise money to provide the fuel that pays for the freight of the lunches and other things they're holding for the family offices to get them to come. What I do think is helpful is that if you find a family office that's been engaged in the area you're interested in from a charitable standpoint, then they might have an investment. So looking at who large donors are in the areas. So Helmsley, for example, has been very active in diabetes.
Yeah,
And
they're
they'll
the
know
ones that
others.
they're our
And they'll
partner
know
on the
others.
T1. Yeah, they're the one on the type 1 diabetes. They're the partner on the type 1 diabetes moonshot, as is JDRF or Breakthrough T1D. And so,
Yeah.
yep. Excellent.
Good.
Thanks, Ed. We have a lot of questions in the chat. Thank you. I'm gonna hand it over to Mark Rothman.
I have to come to this session in order to see Mark. My goodness. How are you? We can't hear you, but you look good. We can't hear you though, Mark.
Oh,
But Mark, I can read your lips.
I'm gonna Mark, if you can you get off earphones or no?
I think I'm on audio now. Can you hear me?
There you go. Yep.
Can you hear me now?
Yeah. Did you hear Lee? Did you hear Lee just a second ago or no?
Yeah, I did. Thanks, Lee. I dressed up just for you, and it's nice to see you, sir. I had posed a question. It was interesting to hear you say, talking about sort of 2.5, 3x ROI for every dollar they spend. They've got to make 3. I feel like I've been proselytizing the 2.5 to 3.5x ROI for clinical and technology services together for years, built some products inside of other big organizations that delivered that, but both inside the company and also when I talk to people externally, if I'm not talking 6 and 7x ROI, they've got blank stares back at me. I'd love to hear you talk a little bit about the idea of a 3x ROI versus a 6 and 7x ROI that I feel like that differentiates you. I haven't heard anybody say that out loud in a very long time.
Mark, I will tell you that we spend a lot of time, and again, I said our LPs are health systems, and we have a number of large health plans. Certainly, if they're negotiating, they may be, saying they want something higher, but they contract based on the promise of 2.5 to 3x day in and day out. And it's not something that I would say is an aberration among our companies. We have 25, 35 portfolio companies that are all contracting with at-risk medical groups, self-insured employers, health plans, and they're able to contract and demonstrate that. I think that what you'll find is that over time, the bar gets raised, right? And so it's a, what have you done for me lately type of situation. And there's an expectation that you need to deliver more. That may not necessarily be more, in terms of the ROI, it might be more features in order to deliver a greater degree of value. But I have not been, hearing and across, the board with my partners and us, we're not bumping into that 6x type of issue. So that sounds different to me. And they probably are trying to push you, Mark, because they know that you're pretty talented, and they want to see you do a little bit more.
Thanks for that. Thanks for the comment. That's really helpful. Good to see you.
Thanks, Mark. Hi, Mike. Sorry, Mike, you're up.
Sorry. Yeah, just asking if so
Actually,
Mike Ferrari with Sensilin. we're developing a glucose responsive insulin. Great to see you, Lee. Curious if any of your companies have gone in front of the FDA recently. We hear it's a little bit of a mess. Just looking for some anecdotes or ideas there.
Interestingly, we've been hearing that with all the job reductions there, things are slower. On the other hand, they are being responsive. One of our companies received a response more quickly than they thought. It was a digital therapeutic. I think it depends on the area that you're in and the nature of the resources that are available to address your particular issues. So new molecules in certain therapeutic areas where there was a greater loss of personnel might have a slower time responding than those where there hasn't been as much attrition. So it's going to be a little bit catch as catch can, I'm afraid, in terms of how they're addressing things. In your space in particular, I'm trying to recall, and I'll have to go back and look because it was a note I just received in the last couple of days that was more cardiometabolic, that did receive some positive responses along the timeline that they'd been promised initially. And so they had not seen a fallback in terms of that. But generally speaking, I think you can expect that new applications are going to just be slower than anything we've seen previously.
Super helpful. Thank you.
Thanks, Mike. Nandan, you are up.
Hey, Nandan, good to see you.
Yeah, likewise. Good to see you, Lee. I just had a question.
Actually, just introduce yourself real quick.
Oh,
and-
sorry. Nandan Rao, CEO of Starlight. So we're working to develop virtual programs with health systems to help them with cardiometabolic patients. But yeah, I had a question. You mentioned a couple of examples. A health system that's operating at a 1% margin and getting slammed, and folks who's serving mostly corporates and it's kind of insulated. So obviously I understand from a conservative perspective, investors want to go to a safe harbor in a storm, like go to a folks type company that's working with corporates. But then we're leaving the health system out in the storm to deal with uninsured Medicaid, Medicare patients, right? Do you see opportunity in supporting those kind of patients, those kind of systems, et cetera, in this policy environment? Do you hear talk of people talking of that as opportunity? Or is it purely like, let's run away?
And when you say let's run away, meaning the health system's going to run away, or?
Money running away from the health
Okay.
systems and the uninsured, the Medicaid, the Medicare, and running to corporate where it's sort of insulated, right?
No, I think that the leaders that I'm speaking to are saying that they're going to find ways to get their mission funded. I think they're going to rely much more on philanthropy than they've had in the past. Some, of course, have deeper endowments than others. I think there's a belief that these challenges are going to be short-lived. How short? Is it 3 years and 9 months, or is it shorter? Or could it be longer than that? But there's an expectation that they're going to find a path through to do that. I think the importance is, doubling back on some of the conversations that we're having regularly with these CEOs, they're looking for solutions that are going to make them more efficient, leaner, be able to provide care. So to the extent that you're able to help them reduce length of stay so they can turn beds over more quickly, if you're able to take burden off of them at a cost that's lower than what they're experiencing now, I think they're going to be open to having that dialogue because they need to find ways to address that. One of our companies is very focused in providing support for health systems to manage their patients' out-of-pocket expenses, a company called Payzen. They've seen a tremendous amount of increase in the level of both meetings, but also new contracts that they're signing because there's a tremendous concern about cash flow that these health systems are getting. So, if you're helping them collect more quickly and the like, that also is a positive event for them.
Great, thank you.
Thanks, Nandan.
Thanks, Dan.
Hi, Michael. How are you?
Michael, there you go.
Good.
There you go.
So I'm part of the T1D Moonshot. I'm co-founder of Niche, Novel Interventions in Children's Healthcare. We intervene in the social determinants of health for high risk, high costs, high needs youth living with type 1 diabetes. And so my question is really about the ROI piece. We have data to support that we do have a 3-time ROI for the intervention that we use. But what we've heard is that kids don't keep the bean counters up at night because in healthcare, adults really drive the cost curve. And so while they're impressed with our outcomes, it's not really their focus. It's not their priority. It's adults with 3 chronic health conditions who are in the hospital for 200 days at a time and are really using a lot of the resources. Any thoughts, strategies about how to navigate those conversations?
Well, and so you may, already be pursuing this, but children's hospitals, of course, are going to be more interested than others in terms of partnering with regard to that. Medicaid programs with CHIPS coverage are going to be interested as well because they have to be focused on cardiometabolic health of those kids that they serve, and that's again they're 100% covered under Medicare, so they'd like to stretch those dollars further. I think that with regard to your traditional commercial insurer, it's probably true that the cost associated with children is not as high as adults with 3 chronic conditions, generally speaking. But a child with type 1 diabetes can have a cost of $10,000 to $12,000 a year if my data is still current. And they should be concerned about that. And so I think that even if you go in and start to work with a plan to say, look, give us a cohort by cohort comparison. Let us take on a group of kids with type 1 diabetes and compare them to the ones that we're not serving, and let's see what that cost difference is like. And let us prove it to you with some type of return guarantee. I think you'd get some folks to participate and agree to dig in on that, because those kids do have high costs, especially for kids who are newly diagnosed. Because as you may know, the typical diagnosis is occurring hospital visit, and then there may be follow-up hospital visits as well.
Great. Thank you very much.
Have you tried that, Michael, actually? Out of curiosity, his strategy? I like that.
You mean like a risk model?
Yeah.
So yes, we've approached payers. We mostly contract with Medicaid. We do also have some contracts with commercial insurers. But what a lot of the people in the Medicaid space will say, well, how do you prove a negative? So they really believe in regression to the mean, which is really asinine, because these kids don't magically regress to the mean. They either continue to get really sick and die, or they go on Medicaid as adults and they continue to drain the system of a lot of resources and money. But their horizon is, the next month, PM, or their, next couple months. And so they wait. So we may approach them with a child who's had 6 DKAs in 3 months and has already cost them close to $100,000, including a flight for life. And they're going to wait to see what happens because they think that's a blip on the screen.
Yeah, that's unfortunate, because I would say that, even as I think back on our experience with health plans relating to individuals with diabetes, many of whom were T1, not the majority, but certainly a meaningful percentage. The nature of that kind of comparative program that we would run to say, we'll do cohort analysis, we'll do kind of a before and after, here's what your costs have been, let us work with them, and then let's compare the costs or compare cohorts, was very powerful in terms of getting those plans to work with us. So I'd say stay at it.
Yeah.
We actually have a manuscript that's revise, resubmit, which is a comparison of those who are referred to the program and we didn't have a contract on versus those who were served and we did have a contract. So we actually have a cohort comparison. And once we get that data out and get it published, then we'll be able to put that in front of payers and see if that changes their mind.
Perfect.
Good luck.
Thank you.
Good luck to you.
Yeah, thanks, Michael. Hey, Keelan.
Kaylin, you are not in New York anymore.
Yes, I'm not New York. I'm definitely Texas. And potentially Birmingham, but I believe we may have bumped into each other in the past. But Keelan Swain, Greens Health, and we primarily help people in the cardiometabolic space, like diabetes, who prefer eating foods like greens over kale. And the region of population is like either rural areas or inner city. And we have a tech-enabled service play, similar in the Livongo domain, where there's for us, we precisely focus on nutrition and social care coordination, but everything else is like remote monitoring and chronic care management. And so one of the questions I have is when we first started, we was primarily in the digital health space. But as we start to work with patients, we realized that, the tech-enabled services really matter. And the doctors we were working with, they didn't have enough bandwidth to actually meet with the patients in between. And my question is about like, and you probably have experience with the previous company, is the tech-enabled services, uh, I'm seeing them scale more effectively than just pure digital health solutions. But I would love to know from your experience, in the companies you backed, have they all been, to tech-enabled services, clinicians or social with the digital, or have you seen digital players be able to be successful with helping patients as well?
So the companies that we've backed have a combination of tech and touch. I think in healthcare, it's really challenging to build the level of trust that you need if it's tech only. So oftentimes many of them start with some type of onboarding or coaching session. And then as that relationship is built and there's trust that's there, individuals are actually not only happy to use the technology, texting or asynchronous solutions that allow them to get their responses done. But oftentimes they feel like they can get a faster response than trying to schedule a visit if they can text and ask a question, or if we can proactively kind of give them guidance. The challenge with regard to those combination models is finding the right scale. And in some communities, people like to talk a lot. And we had really loving, coaches, what we called, they were health coaches that were working with us. They might talk to someone for 30, 40 minutes. Well, that's not too scalable if you can only handle like 2 people an hour. And so you had to find a way to make sure that people were getting their questions answered and that you weren't just becoming a source of an outlet for an individual who wanted to have that conversation. The final thing that I would say is that, the advances that are occurring with regard to agentic AI are going to be able to provide scale in areas where, people still may want to have a human-to-human interaction. I certainly hope so. But other things like, onboarding, answering questionnaires, transferring certain files and records, placing certain orders, like those are things that can be done in a way where you interact with a compassionate agent that appears to be human-like, and you don't mind, but you always know that you've got a button that you can press to speak with a human at any time. So it's the Waymo kind of approach to healthcare. If you've ridden in Waymo, you can get in the car, no driver, but you can always press a button to talk to someone if you need to.
Okay, that was good. Thank you for that one, Lee.
Thanks, Kaylin. Michael Byer, quick intro and quick question so we can get a couple more in before we wrap up.
This is Michael Byer. I'm in the mental health space. I met you when you were a little baby at Allscripts. I was one of the first members of the App Store with Tina Juros.
Yeah.
That's a long time ago. And I did that because we wanted to have interoperability, and that was at the age where everybody had their own EHR. We've now grown up to where we stuck M3, which is this assessment we have, into the LabCorp platform, because LabCorp is interoperable with everybody. On top of that, we now have a CPT code, so it makes mental health formally a stigmatizing for free healthcare event, something that pays. My question to you relates to your AI thing, The person that sets the payment for CPT codes is the American Medical Association. We have this secret project called Page 4, which is clinical support at the point of care. It's attached to the other 3 pages of our report. We went to the AMA and said, hey, there's CPT codes that pay for the first 3 pages. Can you pay for this? Because there's a shortage of psychiatrists. When you hear this, does this give you any ideas about generating payment for AI or clinical support?
Well, I do believe that the AMA is spending time, as you know, they've been advancing a number of codes that have been helpful in the digital health realm. They are looking at ways in which to not only improve codes for human-to-human coaching, but also machine-to-human coaching. And there has been a work group that has been working on it. I can't tell you what the progress of that has been.
I'm on the work group. It's miserable.
All right, you've been going to the work groups.
It's really hard.
And but the fact that they have them, means that they're paying attention to it. And I, know that it's a process in terms of trying to get that through. We spent close to 5 years getting them to agree that electronic prescribing would be a standard of care. So, I'd say stick with it. But the fact that there's a work group around this is actually a positive sign. And there are individuals at the AMA in their CPT group, which is one of the larger sources of revenue for the AMA, that are very, very, very interested, and they're motivated to find ways to add additional codes and to extend codes. So I think there's going to be positive movement there.
Well, bless you. And if you ever talk to Tina Juros, tell her that Michael from M3 sends his regards.
I sure will, Michael. Thank you for saying hi.
Corey, real quick quick question. I know it's under tight time, so I just wanted to see if we can get 2 more in.
No worries. I'll try not to be verbose. So, I'm Corey Mitchell, founder, CEO of Entrevita. We're a precision nutrition company, and love to get your thoughts on this idea of, our last go round with some VCs were really kind of signaling that we need to be prepared for a quick exit. So the idea was to exit in 5 years, and with an M&A deal. And I'm like, okay, what we're trying to accomplish is really truly a moonshot, and that's going to require more than 5 years, I think, to accomplish that mission. So I'd like to get your thoughts on how you think about this notion of mission versus investment margin, and whether founders like us who are in the moonshot community should be looking at staying the course for an IPO versus a quick exit.
I mean, you're raising a really important point, and I will share with you that we see a lot of decks. We talk to close to 2,000 companies a year. When we see slides that say, here's our exit plan, we're going to exit in 3 years, or here's the likely candidates to buy us, we normally tear those pages out and rip them in little pieces. Because what we want founders to be focused on is building great companies. You build a great company, as we started this conversation, focus on profitability, build a model that can scale. Doesn't mean it's going to be profitable day one, but you have a pathway to get there. You can demonstrate it. Then you get a lot of optionality. Good things can happen when you make those types of decisions. What I would say is that, in certain areas though, and this is an excellent point, moonshots take more time to be nurtured. It's the nature of the moonshot. It's the challenge of continuing to go after something, even after everybody tells you the idea is ridiculous and it has no chance of success. And thank goodness Jennifer Doudna didn't give up on mRNA, because had she done so, a lot of us would be a lot sicker. And so I think that requires, in certain cases, that you're not going to be looking at traditional venture capital. Too many of my colleagues in this space, are thinking about, we've got to kind of get an exit within 3 to 5 years, and that's the length of time. You'll need to probably go ahead and look for those venture firms that have a much longer time horizon, those who are more strategically focused. So there's a number of strategic investors, including, corporate venture. I will include some health plans in that as well. There are people who recognize in the science community, there are many life sciences companies that have venture funds, that it takes a long time for some of these ideas to come forward, which is why, medical device investors are pretty patient. Biotech investors are pretty patient because they know it's going to take 6 to 7 years, and then you've got to get cleared. And then you've only got so much time on your patent life in order to get a return.
Thanks so much, Lee. Thank you for your time and wisdom.
All right, thank you so much. And I'm gonna actually broaden it out so the whole community can see each other and you. I two quick questions, Lee. When you think about, pipeline products that take a long time, you just started talking a little bit about this, and kind of curating venture, really differently. I think oftentimes, especially early stage startups and founders, want to go right to what are some of the brand name bigger VCs. And so maybe a little bit of color on how people should think about categorizing those where there's a, quick exit kind of time frame of, 3, 5, 7 years. I think some of the capital intensive startups that take a long time, like you just described, and maybe give a little bit of color on how you would advise it even outside the 7-wire for founders to think about it.
Yeah. So, when I look at companies that have had some of those long cycles, I serve on a board. We invest out of an endowment at the University of Chicago. And, in years past, a lot of the type of funding we would do was valley of death funding. Someone received a grant, they were doing research, or they had some funded research. Maybe they were a funded chair at an institution. Then they needed some early stage capital, and we'd be a catalyst for bringing on more angel money. I think you need to find in this situation, especially where universities may have less research dollars to share, the philanthropy market, the ones who were funding a lot of research independent of government funding that occurred at universities and health systems, are philanthropists that are interested in finding long-term cures. We have a good friend in the Chicago area where there's a family foundation that's put a lot of their money into finding cures for neurological disease, and have been spending time recognizing that it's going to take a long time to get anywhere that they can get to with regard to discoveries. And so you got to plant a lot of seeds or dig a lot of holes, depending on if you're from Texas, like Kalen. You got to dig a lot of wells, in order to find something that's going to produce some oil. And I think there are investors to do that. A shout out for another venture fund, Landmark Ventures. They run something called the Social Innovation Summit, that I know someone important to Unity will likely be at, where there are funders that are coming from around the country that have very cause-based funding, a number of foundations that are there. I've gone in the past because I'm meeting people who are interested in things that might be tied to the type of work that our companies are doing, or I'll meet companies that I would have never met because they're not coming to the traditional sources of venture. They're looking for those types of foundations and the like. So great question.
Excellent. Lee, any wrap up, biggest insight from our time today? I'm going to ask two founders, Anna Gooch and Bill Iwanowski, to do biggest insight from their time, but I wanted to give you a moment to
just a big thank you to all of you for being here. Great questions. I'm sorry if we didn't get to all of them. I did see a note about how you can reach out to me.
We've always appreciated your support of this collaborative community, Lee. I'm going to give Anna Gooch, Bill Iwanowski, biggest insight from today's session with Lee.
Oh, thanks so much. I appreciate it. And thank you, Lee, for being here. It was really an excellent session. For me, it's demonstration that you can improve outcomes and reduce costs. I know we're there. It was very helpful to hear from the last question for those of us with fewer than who will not be profitable within 5 years because we're developing cellular therapeutics, that we should go elsewhere, such as Landmark Ventures. I really appreciate the help with that.
And Bill.
Hi, Lee. Thanks so much for joining today. I think I was on a previous one as well and found it just as insightful. I really enjoyed how you gave real granularity to how 7Wire looks at companies and the three things that you want to see. That helps me think about how I develop my business. And then, as we all look for alternative sources of funding, that conference that you just referred to is another great insight that I will do some investigation on.
Fantastic. Lee,
Thank you, everybody. Great to see you.
take care. Have a great day or evening, everybody. Bye-bye.
The true power of a community lies in its members. At Startup Health, the most visionary founders, CEOs, and innovators come together. These leaders are driving bold health moonshots with remarkable achievements and deep networks. Being part of this community means you're surrounded by the best, gaining access to a world of expertise, experience, and collaboration that accelerates your journey and pushes you further toward your goals. Everyone in this community is fully committed, creating a powerful, mission-driven environment where success is built together. Visit startuphealth.com to join us and participate in live fireside chats with industry luminaries like today's episode with Lee Shapiro of 7Wire Ventures.